Nerve plexes are networks of interweaving anterior rami of the spinal nerve. So the term rami is not important to remember. Just remember that a nerve plexus is a network. There's also plexuses in the body, which are groups of capillaries. In this case, we were referring to groups of nerves. These plexuses split into multiple named nerves that innervate body structures. So there's a few specific nerves out of these plexuses that you'll need to know, and I will point those out. The first plexus is the cervical plexus and brachial plexus. Both come out of the cervical enlargement of the spinal cord. Then there is the lumbar plexus and the sacral plexus, both of which come out of the lumbosacral enlargement. So let's first take a look at the cervical plexus. As you can see, it kind of looks like a tangled mess of nerves that come out. This is C1 through C5. It has a couple cranial nerves, the hypoglossal and accessory cranial nerve. But the one cranial nerve the one spinal nerve I want you to know out of this plexus is the phrenic nerve. So the branches of the plexus are going to innervate the anterior neck muscles, skin of the neck, and parts of the head and shoulders. So that means that they will control those muscles. But the most important one is the phrenic nerve, the one that you need to know. And it originates from C3 through C5. This very important nerve is responsible for innervating the diaphragm for breathing. So if there's an injury to the phrenic nerve, the person may not potentially live if the diaphragm can't contract. The next plexus, which is just inferior to the cervical plexus, is the brachial plexus. This plexus is responsible for supplying the upper limbs, and it comes from C5 to T1. And each brachial plexus innervates the pectoral girdle and the entire upper limb. So major nerves include the axillary nerve, the median nerve, musculocutaneous, radial nerve, and ulnar nerve. So there was only one nerve to know from the cervical plexus, but there's 5 spinal nerves from the brachial plexus. So within the brachial plexus, we can see the axillary nerve in the armpit area, which is what the body region axillary actually means. The musculocutaneous nerve, the radial nerve, median nerve, and then finally the ulnar nerve. This chart is showing you the branches of the brachial plexus. The axillary nerve formed from the posterior cord, but it's the posterior division of the brachial plexus, so you should know what plexus it originates from. The median nerve is a very important nerve that's from the anterior division of the brachial plexus. And specifically, it's responsible for sensations from the thumb, index finger, middle finger, and part of the ring finger. When patients have carpal tunnel syndrome, oftentimes it's due to impingement of the median nerve. The radian nerve, located on the thumb side, is formed from the posterior division of the brachial plexus, and it's responsible for extending the forearm, wrist, and digits. The ulnar nerve is formed from the anterior division, and it's responsible for sensations of the pinky. So in our first diagram, we can see the axillary nerve. Second diagram, we see the median nerve. Third diagram, radial nerve. And then finally, the ulnar nerve in the last diagram. For the lumbar plexus, these spinal nerves are formed from nerves L1 through L4. And the main nerve of this division is the femoral nerve. When we zoom in on this diagram, we can see the femoral nerve shown, and there's some contributions for this nerve, kind of from L2, L3, as well as L4. There's a lot of other nerves in this area, but again, the only one you need to know is the femoral nerve from this plexus. And in this cadaver image, we can also see the femoral nerve shown, except part of the labeling is kind of cut off. In the next diagram, we can also see the femoral nerve. And this is a very important nerve that actually innervates a lot of the anterior thigh muscles. So that would, of course, be the quadriceps femoris group, and it's chiefly responsible for knee extension. So if one were to kick a soccer ball, they would be using the muscles innervated by the femoral nerve. The last plexus is the sacral plexus, formed from spinal nerves L4 to S4. And the most significant nerve out of this plexus is the sciatic nerve, which is the largest and longest nerve in the sacral plexus and in the body. And in fact, the diameter of the sacral or of the sciatic nerve is as much as 1/4, the size of 1/4. When there's injury to the sciatic nerve, that's commonly referred to as sciatica.